Hello, everybody. This is Gary. Today is March 3rd, 2022, Thursday. It is now 1:54 p.m. Eastern Standard Times in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm doing pretty good. My anxiety levels are not too bad. My auditory hallucinations are minimal. I can barely hear them, even though they're there all the time. My paranoia is not that bad today. I haven't gone outside, so I don't know what it's really like being around other people today with my paranoia. But it doesn't seem to be that intense. I don't think anyone is spying on me or following me or watching me or trying to harm me or anything like that. My depression is not that severe. I did start an antidepressant 3 weeks ago, Cymbalta, for physical pain, which may or may not be fibromyalgia, but it's for muscular skeletal pain, nerve pain, muscle pain, joint pain. And since it's also an antidepressant, it might help overall with my depression and anxiety. I'm still taking Zyprexa and Klonopin for my psychosis and my anxiety twice a day. 4 milligrams, or I believe 5 milligrams of the Zyprexa twice a day, and 0.5 milligrams of Klonopin twice a day. I have group therapy session coming up on Tuesday of next week, and on Wednesday of next week I'll be seeing my psychotherapist. Thursday of next week, I'm not sure. I'm seeing my psychiatrist, and we're gonna go over all my medicine and how the Cymbalta is doing for my physical pain and my depression and anxiety. My psychiatrist, interestingly enough, is not the one prescribing Cymbalta, the antidepressant. That's being prescribed by my primary care physician, because the main reason I'm taking it is for physical pain, not for depression and anxiety, but it may help overall with my depression and anxiety. I still have some physical pain, especially in my right knee. I skipped group last Tuesday of this week because I could barely walk on my right leg, so I didn't want to make any injury any worse, and I'm not sure what the injury is. I had an x-ray done on my right knee. It only showed that there were no broken bones, fractures, or dislocation of the joint, but there may be cartilage or tendon damage that doesn't show up on an x-ray. I have an MRI scheduled for my knee, I believe on the 24th of March, and if there's any damage, that will pick it up. I'm still taking gabapentin, also known as Neurontin, for nerve and physical pain. I'm still taking arthritis strength Tylenol for arthritis and joint pain. I am still taking Flexeril for muscle spasms and muscle pain. I have a lot of doctor's appointments, a lot of therapy appointments, a lot of physical therapy appointments, dentistry appointments that I'm juggling over the past few weeks and the next couple of weeks, so I'm going to be very busy running around from one doctor's office to the next for one procedure or another. I saw the orthopedic specialist day before yesterday. We went over the x-rays of my spine. One of my discs is very, very thin in my lowest part of my back. There's also a lot of bone spurs and arthritis in my lower back. We talked briefly about my right knee, but we didn't take any action on that other than continuing physical therapy, because the orthopedic specialist didn't have access to the x-rays of my right knee that we're taking at one of the other hospitals, Highland Hospital here in Rochester, New York. Overall, I'm doing okay. My symptoms are not that bad today. My psychosis seems to be under control. I'm trying to stick to my daily schedule as much as I can. I'm pretty free for the next couple of days. Tomorrow, Saturday, and Sunday, there's no appointments or anything in particular that I have to do as far as doctor's appointments or psychotherapy appointments. I do have to see the dentist on Monday. One of the other dentists recommended that I get a tooth extracted because part of the bone in my mouth is sort of hollowed out, and it would be just a good idea to remove the tooth in that area of my mouth. I've already had over the years plenty of my teeth removed, and I think they're planning to remove another one. Not on Monday. I think Monday's just an exam and a cleaning, but eventually they'll get around to extracting the tooth. So there's a lot going on. I'm going to stop doing live streams because it really fucks up the video quality and just makes everything really difficult. So I'm not going to do live streams anymore. Right now I'm recording this on my laptop, and that's the way I'm going to do it from now on. Like, share, comment, subscribe. Let me know if you want me to do a video on a specific topic.